Hello everyone. Today I'm here to present a case on premenstrual syndrome. It is the 18th case of our gynecology series. To know what premenstrual syndrome is, let's learn a brief definition about it. Premenstrual syndrome is a set of symptoms which involves behavioral, psychological or physical symptoms that interferes with normal day-to-day work, making it difficult to carry on with women's lives. So, if they have a job or any sort of normal work that women want to do who are suffering from premenstrual syndrome, these symptoms occasionally interfere with their work, making it difficult. And there is a severe version of this syndrome known as premenstrual dysphoric disorder, which has additional symptoms and it is very severe. And it not just occasionally disrupts a woman's life, but it it is really hard for a woman to live with that disorder, and they might have suicidal thoughts. And all of this is usually caused due to hormonal imbalance. So let's learn about this case. A 37-year-old mother presents to her general practitioner with cyclical labile mood swings. She says that she has always suffered with premenstrual syndrome and that it is in the family, as her mother had to have a hysterectomy for the same problem. She reports her periods as always have been painful and that she has always been irritable leading up to a period. However, now she feels that she is not herself for at least 2 weeks before her period and that the pain has worsened. So she has been suffering these symptoms since a long time, but recently it has been much severe and the pain has worsened. And there is a longer duration of mood swings that she's suffering from. She also notices headaches, swelling, and breast tenderness. Her periods are generally regular, with bleeding for up to 6 days every 27 to 31 days. She has had 3 children, all by normal vaginal delivery, and the youngest is now 5 years old. She has no other medical history of note. She has been married for 14 years and she says she often feels aggressive towards her husband or alternatively is tearful and low. Prior to having children, she worked in a bank and is not sure whether to return as she feels she might be unable to go. So, all these symptoms are disrupting her day to day life, and she's not sure whether she should return to her job because she fears that these symptoms might interfere with her work there as well. So, further examination was performed, and there was no abnormality found on abdominal or neurological examination. So, the possible diagnosis that could be made in this condition is of premenstrual syndrome. This diagnosis should be confirmed with evidence of symptoms occurring in the luteal phase and resolving within a day or two of menstruation starting. So, premenstrual syndrome has a characteristic feature, that is, these symptoms do not occur throughout the month, but it starts during the luteal phase, which is after the ovulation or after the formation of corpus luteum, which is around 16th, 17th day of the cycle, and it resolves within a day or two before the menstruation starts. So, these symptoms usually resolve when the menstruation starts. The differential diagnosis could be of depression, which can manifest in a similar way to premenstrual syndrome. So, depression does not involve the physical symptoms that are noted in these women, like breast tenderness or bloating or abdominal pain, but rather all the psychological symptoms could be uh, diagnosed as depression if she does not have like other physical symptoms or behavioral symptoms. So, other differential diagnosis should be ruled out before we can conclude that this is premenstrual syndrome. For premenstrual syndrome, there is a thing called a symptom diary in which the woman is told to note the severity of her symptoms and for how long she is suffering those symptoms. So there are columns for every days in a month, and whenever she feels she is facing those symptoms, she needs to mark it on the particular day, and she also has to mark how much severe those symptoms are so that we can assess if it is occurring during the luteal phase or not. If it is throughout the month, there could be some other diagnosis since premenstrual syndrome usually occurs in the luteal phase and it stops or resolves when the menstruation starts. So this is mentioned here. Premenstrual syndrome starts after mid-cycle. Symptoms should resolve with the period and there should be a number of symptom-free days each month. So those symptom-free days might involve the menstruation days, like most probably from the second day to the sixth or seventh day, however long the patient is having menstruation for, until the luteal phase. So those days would be the symptom-free days. Let me zoom in for some clarity. So, in a symptom diary, this patient was given columns to mention her symptoms and severity along with it. So, the symptoms involve breast tenderness, low mood, feeling aggressive, bloating, and menstruation. So, as we can see, in the first month, which was May, her menstruation started from the 6th to the 12th, and this was a 7-day menstruation. And if we calculate the luteal phase, it would be around 21 to 22nd of this month. So we can see that her symptoms are severe and it is usually seen in the luteal phase till the starting of her menstruation, and it usually resolves around her menstruation. And these days are the symptom free days, which is between the menstruation and luteal phase. Even in the second month, we can see that her menstruation started from the 2nd of June to the 8th. And if we calculate the luteal phase, it would be around here, 17th to 18th. And all her symptoms are in the luteal phase till the starting of her menstruation. And same goes for the third month. Her menstruation started from the 30th of June till the starting of July. And she had all her symptoms, which was very severe, in the luteal phase. And these are the symptom free days. So, this kind of pattern is usually noticed in premenstrual syndrome. And this should be checked for 3 months. The patient should be given a symptom diary and she should be told to note down the severity and for how many days she's suffering from those symptoms to calculate whether this could be some other syndrome or other disorder or whether it is PMS. Let's learn more about this disease. So, premenstrual syndrome is nothing. It is a disorder which involves a set of emotional and physical symptoms, which involves bloating, diarrhea, and mood swings, breast tenderness, etc. That regularly occurs in for 1 to 2 weeks before the start of each menstrual period. So, the 1 to 2 weeks before menstrual period is usually known as the luteal phase. So, to be exact, this occurs during the luteal phase. Those symptoms resolve around the time menstrual bleeding begins. So, as we could see in the symptom diary, the patient's symptoms were resolved during her menstruation days. Premenstrual syndrome commonly produces one or more physical, emotional, or behavioral symptoms that resolves with menses, as we had studied about it earlier. The range of symptoms is wide, and most commonly are breast tenderness, bloating, headache, mood swings, depression, anxiety, anger, and irritability. So, some of these symptoms are also seen in the normal women during their menstruation, but there are some more behavioral symptoms, and it is of more severity. Hence, it is termed as premenstrual syndrome, and it needs diagnosis and this needs therapy in a lot of cases. Premenstrual syndrome does not produce symptoms during pregnancy or following menopause. So, since this condition's major cause is hormonal imbalance, we usually see that during pregnancy and after menopause, the levels of hormone are completely different uh, in comparison to when we see in a normal women. So, premenstrual syndrome does not produce symptoms during these situations like pregnancy or menopause. Diagnosis requires a consistent pattern of emotional and physical symptoms occurring after ovulation and before menstruation to a degree that it interferes with normal life. So, this condition needs therapy and diagnosis. Usually, when it interferes with the normal life, if it is somewhat manageable, if it could be managed with home remedies or non pharmacological therapy, it does not require any drugs or pharmacological therapy. But if it is interfering with the day to day life of a woman, and if she's not able to work at her home or she's not able to perform well in her job, then this requires therapy. A daily list of symptoms over a few months may help in diagnosis. So, for this, a symptom diary is given to the patient through which we can assess her condition. So, how to manage this patient? If the diagnosis is confirmed, it should be discussed with the women, since we all might think, any woman might think that she's facing the normal symptoms that usually occurs during menstruation, but it is not this severe, and the symptoms that happens during menstruation should not interfere with day-to-day life. So if it interferes with a person's day-to-day life, and if it is hard to manage all the work in our normal lives, so the patient has to undergo therapy and That is why this condition should be discussed with the patient so that she knows about her condition, and appropriate understanding and support should be offered to the patient. So, vitamins and oil of evening primrose are not proven in trials but may have a placebo effect. So, vitamins and oil of evening primrose does not have pharmacological effect in this condition, but the patient might think that it would help in her symptoms. So, it might have a placebo effect. A placebo effect is nothing but when the patient is not given a pharmacological drug or therapy, but the patient starts thinking that they are taking some sort of drug which would resolve their symptoms or improve their condition. So, vitamins and oil of evening primrose could have a placebo effect in this patient and might resolve her psychological or behavioral symptoms. Interruption of ovulation with the oral contraceptive pill is often successful in women under the age of 35 years. So, if the patient has really severe symptoms and it needs to be resolved, then oral contraceptive pill could be administered to the patient to interrupt the ovulation and to increase the symptom free days, which is usually after the menstruation till the luteal phase. So it is very less, the symptom free days are very less. So to increase the duration, to increase the symptom free days, we can interrupt the ovulation using the oral contraceptive pill, but only under the age of 35 years, since after menopause, ovulation is not seen. Another therapy that could be given is selective serotonin reuptake inhibitors. It has a good success rate in randomized trials, and the women should be advised that they have a specific effect with premenstrual syndrome rather than just a general antidepressant activity. So, selective serotonin reuptake inhibitors are antidepressants, and it should be given to the patient. And the patient should be counseled that it has a specific effect with premenstrual syndrome, even though it does not help with the physical symptoms in premenstrual syndrome. But if we counsel the patient that it does have an effect, the patient might have a placebo effect. The patient might think that this would particularly resolve premenstrual syndrome symptoms that is noticed in the patient. So, certain examples of selective serotonin reuptake inhibitors are citalopram, fluoxetine, and sertraline. These drugs are a good choice for premenstrual syndrome, and it has a good success rate in randomized trials. Hysterectomy or the removal of uterus would not be helpful unless the ovaries are also removed. So, this condition also involves the effect of estrogen, which is released by the ovaries. So, just the removal of uterus would not help since the estrogen levels would still be seen in the patient. And this would involve risk of significant morbidity with the need for hormone replacement therapy afterwards, which may have its own side effects or complications. So, removal of uterus requires hormone replacement therapy, but HRT has its own side effects and complications. It might involve other severe symptoms in the patient. So, it is not a very good choice, but in her mother, hysterectomy was performed since she was a case of a much severe condition, which was premenstrual dysphoric disorder. In that cases, patient might have suicidal thoughts, and patient finds it really hard to go on with their hysterectomy could be considered, but other than that, it should be the last option and it should not be advised to the patient. So that's it for today's session. Thank you for watching and please share this video. Thank you.